Gland, lobus dexter, sinister, isthmus, maybe sometimes pyramidal lobe, yes, which lies isthmus on what level lies, lobes on what level, you will explain. Topography of this gland, structure. In anatomy, very important structure to know all hormones, their physiology. In physiology, histological structure, you will describe them follicles, stereocytes, colloid in the center. But for anatomy, important structure, topography. What muscles in front, what level lie isthmus, what level lobes, what fascia covers in front. Turn your attention, thyroid gland from the back adjoins to the first narrowings of the esophagus. Pharynx, funnel-shaped organ, continues with esophagus, yes? And on hyperfunction of thyroid gland, what disorders maybe? Deglutition is destroyed. Then the patient said that something disturbed during deglutition because this enlarged thyroid gland compressed origin of esophagus, first narrowing of esophagus. And here you can see behind, above and below for parathyroid glands. Yeah? Glandula parathyroidea. Turn your attention, so many vessels pass this recurrent laryngeal vessels. They are branches of the vagus, superior laryngeal, and these glands so good supplied by vessels. We have superior thyroid vessel, inferior, which divides inside. That is why operation is very difficult. Despite this organ lies in front of the neck, superficially, and operation is take not under narcosis, only местная, local anesthesia, because by control of the voice, these nerves innervate laryngeal nerves, innervate the muscles of the larynx. Under the voice control, remove this thyroid gland and hyper function, intoxication of this gland, thyroid. And it is take about 3-4 hours, this superficial organ removing the operation, because so many vessels, they must ligated. All endocrine glands are very good supplied. When we describe arteries, after 2 classes, after heart, external carotid artery, it gives arteria thyroidea superior, which divides anterior, posterior, then thyrocervical trunk gives arteria thyroidea inferior, and venous outflow, so rich in thyroid gland. Remember this position, yeah? It like surrounds this first narrowing of esophagus. Thyroid and parathyroid glands. This is suprarenal gland. Via topography, you will explain behind lumbar part. Come from this side, my dear. Come, turn from this side. Suprarenal gland cortex and suprarenal gland medulla. They are joints on left side, right side to vena cava inferior, on left side to aorta, not to the upper pole of the kidney. Each kidney here adjoins also to descending part of the duodenum. Here lies behind stomach, behind bursa omentalis of the stomach, and behind adjoins to lumbar part of the diaphragm. Suprarenal gland. Yeah, suprarenal gland. Cortex has 3 zones, glomerular, fascicular, and reticular. And each zone has production of corresponding mineral corticoid, glucocorticoid, and androgen hormones, regulating function of the testosterone, estrogen, and progesterone function. And medulla produces adrenaline, noradrenaline. Here you can see, turn your attention, thyroid and parathyroid, they have endodermal origin from the endoderm of pharyngeal pouches, third 4 pharyngeal pouches. Mesodermal origin has cortex of suprarenal gland, but medulla has ectodermal origin from the ectoderm of the nervous ectoderm of the neural tube, from sympathetic nervous system it is developed. This small gland, what gland is this? Where it is located of newborn? From here.